We are Amoskeag Health. We are 5 distinctly different clinical sites throughout Manchester. We have 15,000 plus patients who are receiving primary care, behavioral health, podiatry, optometry services, along with nutrition, case management, a lot of supportive services. Our primary audience is folks throughout Greater Manchester, usually low income. Some of the worst outcomes, health outcomes, are with people that don't have adequate income and don't have adequate resources and are uninsured or underinsured. We serve the people that need the most services. So it's the difference between equality, where everybody gets the same, and equity, which is where everybody gets what they need. So we are trying to help them improve their lives in health and other ways so that they can become more productive, more successful, and happier citizens of Manchester. We have been partnering with Granite United Way since 1997 when we received our first donation from Granite United Way. So we both give and get from the United Way. We serve as an organization that is funded by the collections that United Way does. And I think the most important thing about Manchester and Granite United Way is really how very local they are. And they, a lot of times when you give to a larger organization, you wonder where are those donations going to go. And they are kept very locally with the United Way, which is really important. I think people that work in this area want to know that their money is going towards services in this area. We can put some of that money that's unrestricted towards our general operating costs, which very few grants ever fund. And that helps us just with our day-to-day business and making sure the waiting room still looks okay, and that we have all the tongue dispensers we need in the exam rooms, and that we can provide wraparound services to the most needy populations. We've also helped Granite United Way get funds out there during COVID for people that were either quickly laid off, lost their housing, whatever. It was sort of emergency, and people had a short application to fill out, and they would be within a day or two be able to get some funds to immediately help them. One of the most important ways that we've collaborated with Granite United Way is through the Youth Enrichment Partnership. And the United Way really put a lot of effort and money into convening a group of patient and child-facing services within the city of Manchester to do things like collaborate and offer group sessions around youth behavioral health issues. So we have had counselors in different settings within those partner organizations, so at Girls Inc. or Boys and Girls Club. We've done summer camps under the Youth Enrichment Partnership and trying to help folks with that behavioral health need that is becoming so critical. For me personally, it has been a joy to work with the United Way in this particular community because of how local it is. And so the reason why I work at Amoskeag Health is because I am committed to the mission. I'm here to try to make people's lives better, and that is the same mission that is shared with the Granite United Way. So that's a key part of that. I also think that how I've seen people and groups in Manchester operate, especially Granite United Way, is not the same in other communities. So I've worked in Nashua and Concord and places outside of this state, and it doesn't seem like anybody quite pulls it all together like Granite United Way does.